And hope you're having a great Wednesday morning. Chris Higgins in the studio, and it's time for our Community Spotlight program brought to you by Desert Financial Credit Union. A big thank you to them for sponsoring our program. This morning we have people in, representatives from Banner Payson Medical Center, CEO Hoyt Scablin. Good morning, Hoyt.
Good morning, thanks Chris. And
also in the studio, RN Keith Gracia. Good morning, Keith.
Good morning, Chris. Thanks for having us.
Oh yeah, and on the phone, AJ Hill, and he's with Banner Health Emergency Management. Good morning, AJ.
Good morning, sir.
So this morning, Hoyt, you wanted to do a salute to our veterans, and both Keith and AJ are veterans that work for Banner, and I'm sure there's many others as well. But I just wanted to highlight a couple veterans that work now for Banner Payson Medical Center.
Yes, and thank you for your service, Mayor.
Oh, hey, very welcome. And I like how, and I think this happened before, because I think we've had veterans in with Banner before, and it was Air Force, Army, and Navy. We still need to get that Marine. I don't think we've got the Marine yet, but...
we've got Dr. Bruce Palmer, our new General Surgeon, but he's Air Force.
He's Air Force?
We've just been missing the Marine component.
And I know myself, I served in the Air Force. And Keith, which branch did you serve in?
I was in the U.S. Navy, Chris.
In the Navy?
Yes,
and
sir.
How long did you serve in the Navy?
Just about 10 years, just shy of 10 years.
Okay. Did you get to travel a lot, or were you pretty much in just one or two
I
locations?
think I made enemies with the right people, because I went from New York City to Southern California for 2 years and then Hawaii for 5, so I really probably ruffled the feathers of the wrong person. Some pun intended, but
no, yeah.
Quite a bit, about 35 different countries,
Mm-hmm.
49 out of the 50 states. Have yet to set foot on Alaskan territory yet, but
Gotcha.
it's on the list.
Yeah, no, I hear you. I haven't been up there either, so I'd love to get up there. And how about you, AJ? Which branch did you serve in?
I served in the Army for about 13 years.
Gotcha. And what did you do? What was your MOS in the Army?
I was military police.
Okay. So when you got out, did you go to work or go directly to Banner or start working for Banner, or what did that look like?
As I was getting out, I was desperately searching for a job, kind of freaking out, not knowing what I was going to do and how to take care of the family. And this opportunity came up for Banner, kind of an easy transition into security. So went into security and I moved up to emergency management now.
Hey, that's great. So what is the role of in emergency management? What are your responsibilities, or what are you doing in that position for Banner?
For Banner Health, my role as an emergency management program manager is to manage the regulatory requirements from the federal government and state regulations in their emergency preparedness. And simply put, that is ensuring that we have all the paperwork necessary and the capabilities to respond to any disaster that happens either to the facility or within the community.
And so you're going to be participating, and Banner Payson Medical Center will be participating in a drill here coming up. I believe an active shooter drill. Is that correct, Hoyt?
Yes. And AJ's the coordinator working with the town of Payson Police, Gila County Emergency Management. AJ, perhaps you could share what you feel is appropriate. We're involving the theater department at the high school.
Oh, okay.
Yeah, which is pretty common in these drills to make them feel real. It's kind of interesting as a non-clinician. I'm not a nurse. I'm or a physician, and so it's humbling when we do drills where we bring feigned or staged casualties to the emergency department. When you do that and the patients are, the actors are moulaged, they have painted blood and injury, it does change the emotion, makes it very real, and so this is going to be one of those types of of larger scale. Heaven forbid, we hope it never happens in our community, but it's our obligation as a hospital and the main healthcare provider, or at least the facility where that healthcare will be provided. In those instances, we want to be prepared. And so we have new nurses, some physicians, there's always this spectrum of experience every day in the hospital, so we need to be training and drilling every year or two because it might be someone's first drill. Some, it's their 30th, 50th, 60th, and so I'll defer to AJ what would be appropriate to share about that drill for the public.
I think you pretty much said the majority of it, Hoyt. Just to piggyback off of it, when you're designing plans and procedures to respond to a disaster, you really want to look at it from an all hazards approach. So you want to design a system that is easily adaptable to any type of hazards or disasters that could be in the area, geographical or international, what have you. So for the active shooter exercise that we'll be doing in the first week of December, it's really focusing on responding to a mass casualty incident where we have an influx of patients that could have severe injuries, or in this matter, gunshot wounds from an active shooter event. The approach is to develop that plan and a response and have that drilled down just like you would in the military. Drill it till it's second nature. So, God forbid, if and when that happens, the hospital has the ability to respond confidently and really focus on taking care and saving the lives of the victims.
It's been humbling preparing. We've been preparing for this drill. Chief Tischer and I, during the pandemic, we were talking about having this type of a drill, but we were really living a drill with the COVID pandemic. But we finally now are able to move forward. AJ's appointment as our emergency manager has been amazing for us. He's very gifted and methodical. And so he's spent some one-on-one time with me. I will be the incident commander during that drill. I'm nervous about that, because I've been in real incidents and been the incident command, but you want to learn how to program your mind to think objectively, and so we have many different roles through the incident. The community liaison, which will work with the police department and law enforcement and fire and ambulance, etc. Then we have our public information officer, which would work with public information releases, etc. And so we've all been practicing. We appreciate the town of Payson Police Department and their participation with us. Fire, other entities have been joining us in preparation plans, because it's all about training. It's all about preparation and practice. But the drill itself is kind of the pinnacle of that practice, and then we'll debrief, and AJ will be there with a number of his team from the Valley with Banner Emergency Management, who will be observing, and then we'll debrief. We'll learn from in all aspects what we can. Each entity, town included, will learn from the drill and identify areas that we feel like we need to refine and polish. And you're never done. And then we'll do this again, whether it's 12 months or 24 months later. A fire is another example where AJ helps us with these forest fires we've had in the region. He joins us for our leader huddle every morning, and he keeps us apprised, and he's our liaison to know if what's going on and what kind of patients we might expect, either the smoke inhalation from firefighters, or just keeps our emergency department toes up. And so on our toes, not toes up. And see, that's a terrible mistake on that. This is why they keep me in administration, not put in the field, guys. You'll make those kind
You're
of
allowed to make
mistakes.
those.
Yeah.
So anyways, I don't know, AJ, if you have any other comments to share on that drill and your work?
Just one last thing is, it's all about the community and how the hospital can support the community, and Payson is amazing, and the agencies and external agencies that have the willingness to participate and build those relationships and build those interoperable plans so that the community partners can respond to anything that is going to happen. And we ultimately place the community and their safety and their care above everything else. And Payson, again, is amazing in their support. And I really appreciate that.
Well, that is good to hear. And it is true, interoperable, where you mentioned that, where the agencies up here really have to work together because of resources. And we're up here, we're not in a metropolitan area, but it's critical that the sheriff's office and the town, Banner, all of us, the tribe, fire department, the surrounding fire districts, are all working together, the county with their emergency department. And it is so much different. You have an emergency plan, a document, you can read through, go through what you're supposed to do, but the exercise gives you that practical experience, and it provides opportunities to identify deficiencies or areas that need to be improved on, or that just, they look good on paper, they sound good on paper, but they don't work in that situation.
I think the United States Armed Forces are the highest trained and most organized force in the world. Now there are others that mirror us and attempt, Israel, you have to tip the hat to them. There's others, but the strength of the military, besides is the training.
Mm.
One of the most organized, decision-making, turn on a dime assets in the world. And so we're grateful that we have veterans at the hospital, and really grateful to be veteran-led with our emergency management. And we look forward to drilling, and we'll make some mistakes in our drill. That's human nature. You make mistakes in real life, and so we hope to learn from them and be prepared to support this community at the greatest times of need, other than what we do every day in the ER. Most people's individual greatest times of need. But when this community has something that requires unprecedented coordination, we're hoping to have been practiced to do better than we would have done without the practice. And so we're grateful for AJ and his leadership and impact on us.
Yes. So now, Keith, coming out of the Navy, did you go to work directly for Banner, or how was that transition for you?
So I was an advanced electronics specialist in the Navy.
Okay.
When deployed, I was part of a Special Forces small group that we enforced maritime intermediate ops.
Mm-hmm.
I found Banner after almost exclusively practicing nursing in New York City. And following the first wave of the pandemic, I took a couple of travel assignments.
Mm-hmm.
And one of those assignments brought me to Arizona, and was trying to establish residency close enough to the metropolitan area down there in Phoenix.
Mm-hmm.
And came across Payson, and the day I came up to look is the day I became a resident. So,
oh wow.
yes, it's funny. I'm from New York City originally, so big town, but concentrated neighborhoods. So you had that small community feel. And then the United States Navy, humongous organization. We work really well in small groups, and I find that here in the small community as well. We work really well together in small groups, and you have to when you're a community access hospital. But you're under the umbrella of a much larger organization, so it was a seamless transition for me. But I found it serendipitously, and this is my new home for sure.
Yeah, that's funny that you wouldn't really think of that coming from New York, just I like how you said large town. It's a crazy big city. We had some students in here from our DECA program at the high school, and they're going to be going to New York in January. And I asked the two girls, I said, so do you know the population of New York City? And the one girl said, 1 million. And the other one, I think she just, threw out a crazy high number in her mind. And she said, 13 million. Like, a little closer, but still over 18, almost 19 million people. I mean, you factor in all the tourists, all the visitors. there's literally over 19 million people in New York City
Wow.
at one time in that little area. It's smaller than Phoenix.
Wow.
I mean, a lot smaller than Phoenix, so it's crazy. But like you pointed out, you have all the neighborhoods. You have the little neighborhoods, and that is there's a real sense of community in those neighborhoods that you find in like a small town.
Sure.
So that's where you were able to connect, and you recognized that when you came up here to Payson, huh?
That small community feel and the transition, was almost just as seamless in the hospital because one, I'm part of the night crew, and inherently we work. You have to work really well in small groups. You have less resources, and I've been doing this for nearly 10 years and almost exclusively at night. So that sense of comfortability in a small group, knowing that you have pick places you can rely on when you need to reach out, so we always feel well supported as well too.
Patients love Keith, by the way, and
Yeah.
not just because of his awesome accent.
What accent? So how big, with AJ, he went from military police to, an emergency management position, which is pretty similar. But in your situation, electronics, working in electronics to nursing. So, and I know I was in electronics, I did cryptographic maintenance in the Air Force, so working on equipment, not, dealing a lot with people, but it's equipment. And now going to a field where it's very people-oriented. Is that something that you felt like you always were gifted in that area, working with people when you were working with electronics?
That's a great question, and I appreciate it. I was a sonar technician, so component level electronics, search, classify, prosecuting submarines. With that electronics training, my first job without a college education, I worked for a biomedical company, Siemens, a big German company, and they have their feelers and everything.
Yeah.
So about 3 years with 3 different biomedical companies working on equipment that you'll find in most hospital laboratories or in the bigger labs. I found myself in a lot of oncology centers in New York City, and one day I came home to my family and said, I don't want to work with the machines anymore, I'd rather work with the people. So I said, I'm going to use my GI benefits and go to nursing school. So I did, and went to college and became a nurse. It must be in the blood though. My dad's a retired New York City fireman, but he's also a registered nurse, and my mom was a registered nurse for almost 40 years. So it's in the blood in some capacity.
Yeah, that's right. My mom's a nurse as well. She worked at a hospital back in Pennsylvania, but then went into retirement centers and just gravitated towards the elderly, and then did home health care as she got up, further along in life, and coming out to Arizona. So yeah, the nursing. But it's interesting because I can relate a little bit. I'm definitely more of a people person. And working with electronics, working with equipment, it kind of wore on me a little bit, where I needed that interaction with people. So when there were positions like an instructor or other training positions, I always gravitated towards that because it allowed me to have that interaction with people versus just being in the back room, where the guys that wanted to be on the benches and loved the equipment, that's where they stayed. When they had to deal with people, they're like, no, you go talk to them, you go deal with them. So it's interesting. So veterans, there's other veterans also with Banner.
I think we've had Carol Grush on our program before. She's also U.S. Navy, and she's our, now she's not, her role has expanded to, she's originally infection prevention, and now she's also quality. And we've been, this morning I've learned that we may have received an award for being in the top quartile of quality for patient experience and outpatient outcomes from a different entity than our last award. And so I'll share that in the future when I'm able to validate, confirm details so that we can celebrate that award. But Carol Grush, veteran, leads that effort for us. And we also have many staff who have children that are actively serving, and so we've offered some free meals for our veterans in our cafeteria over this last week, and we're honored to have them on our team, and we look forward to the veterans that will join our team moving forward over the years ahead. Thank you for becoming a nurse, Keith.
My pleasure.
What a great story. We're excited about that.
Mm-hmm. And so you got to get these guys together, or I don't know, have when the Army Navy game plays.
Second week of December.
We could, yeah. How does that sound, AJ? Do you ever get together with some buddies or for the Army Navy game?
I try not to watch because I usually walk away disappointed.
Come on.
Hey, but not this year. Army's on a roll and Navy's struggling, so.
Yeah.
This is true. There was a period where we did have 14 years in a row, but they've had a number the last couple of years. So, you know, on that particular day, it's wonderful. Thanks for bringing that up too, Chris, because we're all on the same team 364 days out of the year, but that one day we get to play each other. It's fun.
There we go. I know a lot of games, well, John F. Kennedy Stadium, just looking online, you know, Philadelphia Municipal Stadium used to be about 41 games in Veterans Stadium, Franklin Field.
The Meadowlands in New York City.
Meadowlands, yeah.
Well, that's New Jersey actually, but.
Yeah. Yeah, Giant Stadium, yeah, playing some games there. But
Air Force is leading the Mountain West, and they're number one in the Mountain West. That's where my alma mater sits, in the middle of the pack. But Air Force is dominant this year.
It's the altitude.
In football. Yeah, the altitude. Colorado State, or Colorado Springs, they'll get you. You know, one thing, Chris, I would share, I was thinking, to those that are veterans listening, you know, we've really tried to remember that 7,000 out of the 25,000 in what we consider our service area includes Pine, Strawberry, Young, Tonto Basin. That's a significant percentage of the population that are veterans here. That's unique. And so we're really seeking ways to enhance healthcare services for that population. And we've recruited an orthopedic surgeon, Dr. Michael Manning. Hope to feature him on the program sometime in the future. And he's joined us, started in October as an employee, been here for about a year as a visitor. And now Dr. Bruce Palmer, general surgeon, hope to have him on the program as well. He's great. He's from just retired 20 years from the Air Force, and chose us over Alaska, where you two gentlemen have not yet been. He loves Alaska, but he chose Payson over Alaska. So those are some basic services, but one that was brought to my attention just 2 weeks ago is there's only really one option in Payson for hearing aids. And so a community member approached me and said, do you have any resources to try to attract another audiology option for pricing reasons? Because not all groups are contracted with the same payers, and with veterans that's particularly helpful. So I worked with Banner to confirm who the audiology groups in the Valley were that are contracted with that see Banner patients and others, because we want them to serve our employees as well, and any Banner health plans. And so I spoke to an audiologist yesterday he said his interest in coming to Payson is because of the veterans, the number of veterans that drive to his practices in the Valley. And he said, I think I would come primarily for the veterans and some other limited plans. So just an example, and the hospital won't necessarily be part of that at all. I don't have any financial motive or any particularly, we might be able to offer them space if they need it, but in a leased way. But just an example, we're grateful for your service to our nation, and we're committed to doing all that we can that's in a financially sustainable way to serve your healthcare needs in RIM country. And we're seeking every month to look for and identify what could we do more that we could sustain. We don't want to dabble in things that we're going to fail at or not do well. But if we can do it well and it's sustainable long term, even at a break even, we want to bring that to our veterans.
Well, I think we need to mention pain management program that probably a lot of veterans take advantage of that service.
We have seen, we underestimated. We knew the need was great. The primary care providers had said that was their number one or number two need that they wished we had in town. And but the volume of patients suffering chronic pain, needing help, resolving that through all the myriad of ways in which Dr. Latham on our program with you described is significant. And so we're trying to work with Advanced Spine and Pain to increase the number of days each month that they're coming for clinic. And Dr. Latham is booked out with the procedures to address pain for several months now already.
Wow.
One quick story I'd share, I made sure this in the year before, but we did have such a patient who for several decades could not stand upright because of severe pain. And this patient's spouse was describing this and how what a massive unfavorable impact it had on their lives and how hopeful they were. And this individual coming out of had exhausted every other pain treatment up into the surgical procedure that Dr. Latham performed. And that patient, we have to wheel the patients out to their car. That's kind of our policy. And so for the first time in nearly 20 years, this patient stood upright with their spouse in tears, was able to stand upright comfortably before climbing in the car. And so not every patient will have that dramatic of an impact, and there's a spectrum of services that have to be tried before the most severe surgical interventions are engaged. But hopefully change that individual's life for the remainder of their life to have a higher quality. And to the veterans out there that are in line with those services, we're hoping that you'll find a meaningful improvement to quality of your life, and we want you to have that given the service and sacrifice you made for our country.
Yes, I knew that that was getting a great response, that program, so it's great to hear that story, and there's probably others.
Cardiopulmonary rehab is another where we had a patient, we've had a couple patients. Sometimes you come into that program and you're very frustrated with life, you're bitter. That 6 weeks ago I was living my life, I was hunting, fishing, or holding my grandkids that are 4 or 5 years old without any issue, and now I have a massive heart attack and it's life-changing, potentially open heart surgery, stents, etc. Now I have to be careful with what weight I lift, walking from the car to the grocery store entrance I'm short of breath, those kind of things, either for lung reasons or heart reasons. And they come to rehab and they're a little bit skeptical. And we have therapists that help with the emotional side of this treatment, to help with engaging with the treatment plan. And then the nursing team are just, they have chosen this as their profession. They're a nurse. They have chosen cardiac rehab. And we've had 2 patients that have come full circle and have just said, you've saved my life. But more than saving my life, you've raised my life. And so those are those stories you hear and you want to repeat, because that's what those of us that chose to be in healthcare, we want to change lives for the better and make life better by making healthcare easier in Banner's model. And so it's an honor. We're glad to feature Keith and AJ today, and you, Mayor, for your service. Banner honors all of you.
All right, well, thank you, AJ, for your service. Thank you for being on this morning.
Thank you. It was a great pleasure.
All right, thank you. Thank you, Keith, for your service as well. Thank you for all you're doing at the hospital. And how long? I didn't ask. How long have you been up in Payson now?
Well, you're very welcome, by the way. It's my pleasure. I'm wonderful, happy to be here. Been a resident about 2 years. I've been at the hospital just about a year now. So.
Oh, okay, nice. So, hey, that's great. That's great, and it's exciting that, and the story you shared about attracting, the belief doctor that was looking at Alaska or Payson, that we're attracting, people to Payson.
Attracted me to Payson. I was over across 6 states, over Banner's 10 rural hospitals, and this was my favorite. We should not struggle to recruit here. Housing's our biggest challenge, but even then, if people fall in love, you'll find a way to live here. Yep, make it work. God's country, as far as I'm concerned. Amen. The center of God's country. That's it.
That is it. Well, thank you so much, and thanks to everyone at Banner for all they do for our community. It's wonderful. It's a blessing to have Banner here, and definitely a big impact on our community, making it a lot better.
It's an honor.
Thank you.
We're grateful to be here. Thank you.
And thank you to everyone listening and watching today. Also, thank you to Desert Financial Credit Union again for sponsoring our Community Spotlight program. time to get back to the music here on KRIM. Hope you guys have a wonderful rest of your day. All right.
Thanks, AJ.
Thank you, sir.
All right. May the force be with you this fine day. And thanks for your tutoring yesterday, or whatever the day that was. That was